Hello, true believers. This is Corey coming at you with a little different blog post. So, if you follow my blog, whether it was talking about racing or anything else, and excuse my voice, and I'll get to that in a minute, you've heard me talk about most of 2018 running races, running in pain, having some numbness in my arm, a couple of half marathons, some numbness in my foot, like around mile 4, and having to deal with that. So, went to my primary care physician right before I went to Austin for the running event, and they did an MRI and called me later that day to say there was some bulging disc in my C5 and C6 area, and that I need to see a neurosurgeon. So they set up the appointment. I saw the neurosurgeon December 20th. He was Dr. Doss in Norton Brownsboro here in Louisville. Wonderful. I cannot say enough. Awesome, wonderful staff. He himself was great. He sat down with my images and showed me where the disc were pushed. There was no space between the disc and my neck. And that was from the side, the top view looking down, and then showed me like laying down where it was pressing on the nerve. And he was even able to tell me, depending on what finger you have numbness in, what region of your spine where the nerve was compressed, which I thought was really cool. So he was like, yeah, C5, C6. And he was like, how long have you had? I said, for the most 2018. And he said, there are basically 3 options. One was get an injection, an injection in my neck that day. And I said, well, what is that going to do as far as the numbness in my arm? Because I know me, and if I have no pain, I'm just going to go balls to the wall working out. And he was like, yeah, he goes, that's not going to do you any good in the long run. You're going to cause more harm, and it's not really going to do anything for the numbness. And I said, okay, what are the other options? He said, the other option is I just don't, I don't continue to be active. And if I basically do nothing, it will heal itself over time. And he looked at me and he goes, I'm guessing that's not an option for you. I said, no. And he said, the third option is surgery. And he explained what they did. And I said, is that a permanent solution? And he said, yeah. I go, okay, well, let's just get it done. And I said, because we had met our deductible, was there any way to get it done before the end of the year? And he was funny. He was like, this is December 20th. He's like, I haven't looked at my schedule. He goes, I can guarantee like Christmas Eve and New Year's Eve, I'm completely wide open. And I was like, okay. And he goes, well, sometimes those are crap days. I was like, crap days for you? And he goes, no, for the patient. And I said, well, that's fine. I don't have a problem in doing it at all. So he said, can you wait to go downstairs and do blood work? I said, that's fine. Well, his office manager called me about 10 minutes later to tell me he had an opening tomorrow, the 21st, the next day, that Friday. And I said, okay, let's just get this done. I'm tired of this pain. Everything it's really bad now. So had the surgery done that Friday morning, the next day, stayed the night in the hospital. I haven't been able to shave since then. You can see the scar right here. You should be able to. If not, I'll include a picture. So it's been it's been hard. I actually just finished my second treadmill walk. This is the wonderful mini booklet list of things I am not allowed to do. So this past Friday, today being Thursday, so 6 days ago, I had my 3-week follow-up to my surgery. And I guess because, with my knee surgeries and my shoulder surgeries, you go to a follow-up with your doctor like 4 days after, and a week later you're back in physical therapy because they want you up and moving. This is just the opposite, and I understand it is the technical name for the surgery is C5, C6, C5, C6, anterior cervical decompression fusion surgery. So what they did is, and I'll include the x-rays, what they did is they cut open here, peeled this back, went in, pulled out one of the discs, shaved down the other one. My wife told me, Dr. Doss told him it was a little bit more damage than he initially thought. Shaved that down, moved it back, drilled in 4 screws, and then put a titanium sort of carriage there. And I need the bone to grow over that, and that's going to take time. So I went in, since I had surgery before the follow-up, I was, again, that list of things I couldn't do. That included, obviously, no running, no lifting my hands above my head, no carrying anything above, my voice is driving me nuts, no carrying anything above 5 pounds. So that means I couldn't carry my kids, even though when I normally hug them and pick them up, and yes, my teenagers, I hug them and pick them up, and my 12-year-old, good night, hugs and kisses. Basically just sitting on the bed. The first 2 weeks, my wife was able to work from home and keep me from being stupid, from quarrying my way through this. So I went thinking, I guess naively, I went to my 3-week follow-up thinking I was going to have all of these restrictions lifted because, I have 9 races on the schedule starting next month from February to May. Well, went in. I'm still not allowed to lift my hands above my head. I've increased, the weight is increased. I can lift 20 pounds, up to 20 pounds now. I'm only allowed to do walks on a treadmill for short distances, short amount of time, not speedy because I can't have the jarring motion in my neck, so it needs to be flat as well. Not medically cleared to exercise, not medically cleared to run, so my spring schedule of all those 9 races is flatlined. This past weekend, been dealing with a lot of depression about recovery, because I'm at the very beginning of this. If you pull up, like I said, C5, C6, anterior cervical decompression fusion surgery in athletes, and you try to look up any, and I mean reputable places, like look up anywhere online about this surgery and recovery in athletes, you don't find a lot. Most people have this surgery, they either weren't very active to begin with, or they just aren't afterwards. So as usual, I'm in uncharted territory trying to navigate and figure this out. It's hard. Depression has really sunk its teeth into me. I haven't really publicly talked about all of this and what it's meant for my race schedule and things like that. And it's hard to really picture it when I just finished only my second treadmill run. I had to slow it down to 2.5 miles an hour. I did it for 30 minutes, ends up being like a mile and a half, a little over. I'll look it up later, a little over. And I feel that instability in my neck, and it's a very weird feeling when I start to get past that 22, 23 minute mile mark. It is an unstable, weird feeling. So I get why running is, anything else is out of the question. It's just hard. It's just really hard. I haven't been very public about talking about this for a couple of reasons. I'm just going to be honest. One is I don't want to hear a bunch of unsolicited advice from people that have no idea what I'm going through right now. And two, I don't want people sprinkling me with, you should be happy, you should feel blah, 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 and you just be happy that you can do. I'm not in a place to hear any of those right now, so I really haven't been that public about it. Like I said, I did have to flatline my spring schedule. I go back in 3 months for a follow-up, and I have an x-ray that same day right before. He looks at it. Depending on how the bone growth and everything else is done, we start discussing physical therapy. So not even discussing running and working out what I'm used to. You know, I'm used to running double-digit miles for fun. So this is a humbling experience, to say the least. I do want to thank people, you know, everyone that's reached out and has had some honest, sincere, kind words for me. That's not lost on me. I am not getting bitter watching other people's social media's feed, because, you know, if you're running a spring race, you're in training mode now, so everyone's posting their runs, and that's not bothering me. Come race time in a couple of months, I probably will be less visible on social media, just because it'll hurt a lot. I know some people are like, oh, you should come volunteer for this race or that race that I was supposed to do, and I'm not emotionally at that point yet, and that's not going to hurt a great deal, so I'm not going to. So I'm just going to do nothing. And apparently, and I don't mean that negatively, but that's really what my instruction list basically is summarizing itself to, is do nothing. And it's not the kind of do nothing that I'm used to. It really is do nothing. So I'm battling that depression. I'm battling that bit of shame, because I feel like I'm letting my family down. I feel like I'm less of a husband for my wife that she's used to having. I feel like I'm less of an active father for my kids than they're used to having, and they deserve better. So I'm just trying to get through this. I've even started journaling just to get some of this out. I had therapy. My therapist that I go to, I saw her last week. A couple of days ago, last week. A couple of days ago, she was helping me with a lot, and I'm just trying to hold on and keep things going. So thank you very much. Hope you enjoyed this. I'll do another one next week, couple of weeks, to let you guys know how I'm feeling. Thank you very much, and y'all have a blessed day. Stay good, y'all.